Starting today, fully vaccinated people will be able to resume everyday activities without wearing a mask. However, there are some exceptions. And what about people who haven't been vaccinated and those who are still waiting for their second dose? Well, here now to help us figure out this next step is Dr. Ilan Shapiro, Medical Director of Health Education and Wellness at AltaMed Health Services. Good morning to you, and thanks for joining us.
A pleasure to be with you and with the audience.
Thank you. This is a day so many of us have been looking forward to, obviously, businesses reopening and an end to social distancing and mask wearing. But it's not really the end of mask wearing just yet for everyone. What do we need to know if we are vaccinated? And what do you say to those who are not?
Well, it's very important right now that we have the opportunity to get vaccinated. That means fully vaccinated. That means 2 vaccines from Moderna or Pfizer and 1 vaccine from Johnson & Johnson, and 2 weeks afterwards. That way your body is completely immune. The other thing that we need to be figuring out is we need to continue protecting our kids below 12 and have the opportunity to get the Pfizer vaccine for kids right now that it's summer for the Pfizer vaccine. And for sure, you can actually get the information from the myturnca.gov, and that way anybody can actually have access to these vaccinations.
Okay, so you mentioned the term fully vaccinated, and there seems to be some confusion about what is required to be considered fully vaccinated. Some people think once you get the first of 2 shots, or even the moment you receive your second dose, you are then fully vaccinated. But that's not the case. Can you explain?
Completely correct. The first round, especially with the vaccines that we have from Pfizer and Moderna, you need to actually have 2 vaccines in order to have the entire body learning how to protect yourself, and especially 2 weeks afterwards, where your body actually learns and, most importantly, has a memory on how to defend yourself. That's why it's so important to get the fully vaccination for everybody. Then, if you have only one from Pfizer or Johnson & Johnson, Pfizer or Moderna, you need to wait. If you have only one from Johnson & Johnson, you're good to go.
Okay. And you mentioned children, the younger children group. What is the protocol for children under 12? There is no approved vaccine. What advice do you have for parents?
I will come as a pediatrician and as a father. The most important thing is to make sure that we are doing common sense protection for our kids. We know that having this social distancing, making sure that they're wearing a mask when we have a lot of gathering of people that we do not know if they have, if they're fully vaccinated or not. And most importantly, make sure that we're continue to follow hygiene recommendations for our kids. And this is an ongoing conversation. We are all afraid of this, but most importantly, all together, we can make a difference.
Okay. Dr. Ilan Shapiro, Medical Director of Health Education and Wellness at AltaMed Health Services. Once again, thank you for joining us this morning.
A pleasure as always.